Hello, I'm Dr. Paul Firnhaber, and today I'm here to talk to you about a big problem that we're having in the United States right now, and that's the enormous amount of young teenagers and adolescents that are getting sick. Let me talk to you about the current statistics on that issue. In the Journal of Pediatrics, the number of pediatric patients admitted to U.S. hospitals with chronic pain diagnosis increased by 831% from 2004 to 2010. The average patient was a white girl, about 14 years old, with headaches, abdominal and musculoskeletal pain, depression, and anxiety. This study was published online in the July 1st, 2013 issue of Pediatrics. The study was entitled Inpatient Characteristics of the Child Admitted with Chronic Pain. Now, I want to quote you an article out of this, a paragraph out of this article, and then we're going to talk about some solutions to this problem. It says, clearly, the researchers write, more information is needed on the underlying pathologic and social mechanisms that contribute to these patients' symptoms so that we can develop treatments targeted to those symptoms rather than use reactive symptomatic therapies such as opiates and benzodiazepines, which often have addictive potential and a tendency for adverse effects. You know, you have to ask yourself, what on earth is happening to all these girls? Why are they getting sick? And what's causing it? Because we want to look at the cause. You know, I see these girls in practice, and the majority are being treated with pharmaceuticals such as antidepressants, birth control pills, headache medications, and various other pharmaceutical medications. These pharmaceuticals really only mask the symptoms of what's going on. Do you really think that teenage girls have hormone deficiencies? My gosh, when they're 14, 15, 16-year-old girls, their hormones are surging. They don't have hormone deficiencies. Do you think they have antidepressant deficiencies? Do you think they have other pharmaceutical deficiencies? The answer is of course not. We have to look at what's causing these issues and the things in their lifestyle and the things that they're doing that are creating these symptoms in these girls. There are several issues that needed to be treated and addressed when dealing with adolescent teenage girls and boys, by the way. And we're going to talk about those. The first symptom, or the first thing that needs to be addressed, is the autonomic nervous system. This is a part of the nervous system that controls and coordinates the functions that we don't normally think about, like heart rate, breathing, tearing, digestion, things like that. This is corrected or helped enormously through chiropractic care. So one of the first things I would do with these teenagers is get them under chiropractic care and get their autonomic nervous system balanced out. The autonomic nervous system consists of two parts: the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is the fight or flight part of the autonomic nervous system, the one that reacts when you're under stress. A lot of these teenage girls and boys are under an enormous amount of stress, both at school and at home, and this creates an imbalance in the autonomic nervous system, which creates what's called a sympathetic overload. This is something that can be recorded and measured on heart rate variability studies, and it's helped enormously with chiropractic care. The second thing is dietary corrections. Now, have you ever heard of teenage girls not eating right? Of course you have. So what are they not eating, and what are they eating that they shouldn't be eating? First of all, most teenagers eat way too much processed food. They drink way too much pop. They eat way too much sugar. And these create significant imbalances in their bodies. Some of them live off of pizza and fast food. The only beverage a teenager should really drink, the main beverage, is clean, purified, and I would recommend alkali structured water. You know, sodas and things like that many teenagers drink a lot of should be an occasional treat, not a staple food. So that would be the next thing I would do. We want to change their diet. We want to get them off the processed foods and get them on whole foods as much as possible. Whole, unadulterated foods that have a lot of nutrition in them. So what's number 3? The third thing also has to do with diet, and this is about food intolerances. Many teenagers I've found have developed food intolerances. Food intolerances can come from several different issues. Number 1 is antibiotic therapy, which a lot of them have had, chronic stress, nutritional deficiencies, and or vitamin mineral deficiencies, and eating the same foods over and over and over again. Food intolerances can cause GI or gut inflammation and a lot of other health issues such as adrenal dysfunction. Now I have another video that you can access that talks about the adrenals and their importance. But common food intolerances are wheat, it's probably number 1, milk and gluten, soy, peanuts, sugar, corn, yeast, and commercial eggs. So these are things that they need to be tested for to see if they're intolerant to those things. Those intolerances can cause chronic inflammation and all kinds of other symptoms that may not be identifiable through any other way except getting your teenager off those foods. The next thing we need to check for is endocrine imbalances, specifically the adrenal glands and blood sugar. Those are the 2 biggest endocrine imbalances you see with teenagers. Sometimes thyroid, but usually blood sugar and adrenals. If you can get their blood sugar stable through their diet, you can go a long way towards helping those teenage girls and boys. So we want to look at food intolerances, and 4 endocrine imbalances, okay, specifically adrenal and blood sugar. Well, how do you know that they have some of these problems? Well, let's just talk about adrenal gland stress for just a minute. Adrenal gland stress will produce the following symptoms, 1 or more of the following symptoms. Number 1 is they can't sleep. Okay, they either can't get to sleep or they can't stay asleep. That can also be a blood sugar problem. Chronic fatigue, weight gain, depression. These are all adrenal dysfunction disorders. They come from too much stress, whether it comes from the kind of foods they eat, emotional stress, whatever. We'll talk about that in my adrenal video. But these things have to be fixed. And how do we do that? How do we correct these things? Well, in a nutshell, we change their diet, we test them, we give them the right supplements to correct the biochemical imbalances, and that makes a big difference in their health. Now, number 5 is we look at what happens when they have too much sugar in the diet. We've mentioned this before with blood sugar, but this is a whole separate category on its own. First of all, too much sugar in the diet can, number 1, cause adrenal dysfunction, so that can go back and forth. But too much sugar in the diet raises insulin levels, which is going to imbalance their hormones. It'll imbalance the estrogen-progesterone ratio. And even more important than that, it will imbalance the neurotransmitters, dopamine and serotonin, which can create this chronic depression state, which a lot of teenagers have. So their blood sugar has to be balanced. The final thing is we need to check for specific nutritional imbalances, such as vitamin D, magnesium, zinc, the B vitamins, and other trace minerals, all which have a very significant effect on teenagers and their health. When all of these things are put together, it's very, very possible that your teenager can get better from their chronic diseases and chronic symptoms that they may be experiencing. Another thing that's important for teenagers is exercise. And exercise is something that will really make an enormous difference in their health. It'll make everything work more efficiently. So if we can get these things in order, and these things are all testable, they're all correctable, your teenager doesn't have to go to the hospital, they don't have to spend all that time taking all those pharmaceuticals and miss all of that school, is we can correct those doing these simple things and get your teenager back to health. If you have any questions about this, you can contact me. I'm in Lincoln, Nebraska, and my phone number is 402-488-2220. And my name is Dr. Paul Firnhaber. Well, I hope you've enjoyed the video, and give me a call if you have a teenager that you cannot get better.